The 5 leading causes of mortality after age 75, proactive strategies for healthier aging. Did you know that after age 75, nearly all deaths stem from just 5 primary causes? Remarkably, however, most of these deaths are preventable. If you or a loved one is in this age group, the information in this video can significantly extend lifespan and improve quality of life. Discover the 5 silent threats to your health, and, more importantly, the most effective ways to combat them. 1. Cardiovascular disease. The heart, a muscle requiring diligent care for sustained health. The human heart, like any other muscle, demands consistent exercise and proper nourishment to maintain its strength and functionality. Neglecting this fundamental requirement leads to a progressive weakening of the cardiac muscle over time, significantly impacting overall health and longevity. A critical misunderstanding prevalent among many, particularly the elderly, is the misattribution of common symptoms such as fatigue, shortness of breath, and diminished stamina to the inevitable process of aging. This misconception is dangerous, as these symptoms can be early indicators of underlying cardiac disease, often preventable or manageable with timely intervention. Failure to recognize and address these warning signs can lead to serious, potentially life-threatening consequences. Therefore, proactive measures, including regular cardiovascular exercise, a balanced diet, and routine medical checkups, are crucial for preserving cardiac health and mitigating the risk of heart-related complications. Ignoring the needs of this vital organ is a gamble with potentially devastating outcomes. Hypertension, the silent killer. Consequences: elevated blood pressure exerts significant stress on arterial walls, forcing the heart to work harder, ultimately leading to heart failure or stroke. These cardiovascular events can be debilitating and life-threatening, significantly impacting quality of life and longevity. The insidious nature of hypertension demands proactive intervention. Dangerous characteristics: hypertension is often asymptomatic, meaning many individuals remain unaware of their condition until a serious complication, such as myocardial infarction or cerebrovascular accident, manifests. This delayed diagnosis significantly reduces the effectiveness of treatment and increases the risk of irreversible damage. Prevention: regular blood pressure monitoring is crucial for early detection and management. A comprehensive preventative strategy includes adopting a healthy lifestyle characterized by a balanced diet low in sodium and saturated fats, regular moderate-intensity physical activity, and stress management techniques. Furthermore, maintaining a healthy weight and abstaining from tobacco use are essential components of a hypertension prevention plan. Consistent adherence to these preventative measures significantly reduces the risk of developing hypertension and its associated life-threatening complications. Dietary habits: a leading culprit in atherosclerosis. The impact of processed foods is undeniable. Diets high in saturated fats, sodium, and added sugars contribute significantly to arterial blockage, impeding blood flow. The chronic accumulation of low-density lipoprotein cholesterol leads to the progressive development of atherosclerosis, dramatically increasing the risk of myocardial infarction and stroke. This is not merely a correlation. Substantial evidence supports a direct causal link between poor dietary choices and cardiovascular disease. Mitigation strategies must therefore prioritize a significant reduction in sodium intake, saturated fat consumption, and the overall consumption of processed foods. A proactive approach necessitates the incorporation of foods rich in omega-3 fatty acids and dietary fiber, which demonstrably contribute to cardiovascular health and protection against atherosclerotic plaque formation. Furthermore, regular physical activity and maintaining a healthy weight are crucial adjunctive measures in mitigating the risk of atherosclerosis and its associated life-threatening complications. Ignoring these dietary recommendations represents a significant risk to long-term cardiovascular health and overall well-being. Sedentary lifestyles represent a significant and often underestimated threat to cardiovascular health. The consequences of prolonged physical inactivity are far-reaching and potentially lethal. A lack of regular exercise weakens the heart muscle, diminishing its capacity for efficient blood pumping. This reduced cardiac output leads to impaired circulation, increasing the risk of blood clots and a cascade of cardiovascular complications, including coronary artery disease, stroke, and heart failure. Furthermore, sedentary behavior contributes to a range of metabolic disorders, such as type 2 diabetes and obesity, which further exacerbate cardiovascular risk. It is imperative to counteract these detrimental effects through consistent physical activity. While rigorous athletic training is not necessarily required, even moderate exercise, such as brisk walking, gentle yoga, or simple calisthenics, can significantly improve cardiovascular health. The key is the establishment and maintenance of a regular exercise regimen. This commitment to physical activity will not only strengthen the heart and improve circulation but also contribute to overall well-being and a reduced risk of premature mortality. Individuals should consult with healthcare professionals to determine an appropriate exercise plan based on their individual health status and fitness level. The adoption of a physically active lifestyle is a crucial investment in long-term health and longevity. The impact of prolonged stress, elevated blood pressure and cortisol release damage the heart, increasing the risk of heart attack or stroke. Mitigation strategies include mindfulness practices such as meditation and yoga, deep breathing exercises, and cultivating strong social support networks to reduce stress levels. A critical misconception, the erroneous belief that heart disease is an inevitable consequence of aging, is widespread. However, research demonstrates that individuals maintaining a healthy lifestyle can significantly extend lifespan and preserve cardiovascular health. Minor adjustments to diet, exercise, and stress management can yield substantial improvements. 2. Falls and trauma. Osteoporosis and osteoarthritis consequences. Weakened and more brittle bones significantly increase the risk of fractures following falls, particularly hip, wrist, and vertebral fractures. Individuals with osteoporosis may experience fractures from even minor falls. Prevention, adequate calcium and vitamin D intake, coupled with regular exercise, are crucial for maintaining bone strength and density. Loss of balance and muscle weakness. Etiology, age-related decline in the balance system elevates the risk of falls. Sedentary lifestyles contribute to muscle weakness, further compromising balance. Improvement strategies, engage in exercises that strengthen muscles and enhance balance, such as yoga, walking, or light aerobics. Hypotension and circulatory disorders. Impact, hypotension can induce dizziness and lightheadedness, increasing fall risk. Poor circulation deprives the brain of oxygen, potentially leading to transient loss of consciousness. Management, avoid sudden postural changes, rise slowly from sitting or lying positions. Maintain adequate hydration and a balanced diet to support stable blood pressure. Medication side effects. Certain medications may cause dizziness, drowsiness, and cognitive impairment, thereby affecting motor control and balance. Solution: consult a physician regarding current medications. Dosage adjustments or substitution with medications exhibiting fewer side effects may be necessary. Visual impairment. Impact, reduced visual acuity hinders the detection of obstacles, increasing the likelihood of falls. Impaired night vision exacerbates this risk. Mitigation, undergo regular eye examinations for assessment and corrective lens prescription as needed. Improve home lighting to eliminate hazardous dark areas and blind spots. Common severe fractures and injuries include hip fractures, traumatic brain injuries from head impacts, and dislocations/sprains limiting mobility. Psychological impacts include a fear of falling, leading to reduced mobility, muscle weakness, dependence on others, and decreased self-confidence. Falls significantly increase mortality risk in the elderly due to injury complications and prolonged recovery periods. Hip fractures alone carry a 20 to 30% mortality rate within 1 year in the elderly population. Improving the home environment, eliminate tripping hazards. Install handrails on stairs, in bathrooms, and toilets. Ensure adequate lighting in all areas, especially hallways and bedrooms. Outdoors, avoid walking in rain or on slippery surfaces. Use a cane or walker if necessary. Physical exercise to enhance health. Exercises to improve balance and muscle strength, daily walks. Yoga or Tai Chi to increase flexibility. Leg exercises to maintain balance. Regular health checkups, regular eye exams, to ensure good vision while moving. Bone density testing, for early detection of osteoporosis. Blood pressure monitoring and medication adjustment, to control dizziness and loss of balance. A sensible diet, sufficient calcium and vitamin D intake, to strengthen bones and reduce the risk of fractures from falls. Adequate hydration, to maintain stable blood pressure and prevent dizziness due to dehydration. Healthy eating, limit processed foods, increase green vegetables and protein to maintain muscle health. 3. Respiratory illnesses. Respiratory illnesses are a leading cause of mortality and reduced quality of life among the elderly. Age-related decline in respiratory function predisposes older adults to conditions such as pneumonia, chronic obstructive pulmonary disease, asthma, and lung cancer. Understanding the etiology, symptoms, complications, and preventative measures is crucial for managing and mitigating the risks associated with these diseases. Age-related decline in pulmonary function manifests as reduced lung capacity and weakened diaphragm, impairing gas exchange efficiency. Decreased lung elasticity hinders complete exhalation, leading to carbon dioxide retention. Weakened immunity increases susceptibility to respiratory infections from bacterial and viral pathogens. Reduced cough reflex in the elderly promotes mucus and bacterial accumulation in the lungs. Chronic conditions such as cardiovascular disease, diabetes, and hypertension elevate the risk of respiratory illnesses. Gastroesophageal reflux disease can cause acid reflux into the lungs, resulting in respiratory inflammation. Environmental factors and lifestyle choices significantly impact respiratory health. Tobacco smoke, both active and passive, increases the risk of chronic obstructive pulmonary disease and lung cancer. Air pollution, including particulate matter and toxins, irritates the lungs and causes respiratory inflammation. Cold weather weakens the respiratory system, increasing the risk of infection. Pneumonia, caused by bacteria, viruses, or aspiration of food into the lungs. Symptoms include high fever, chills, and productive cough. Dyspnea and chest pain upon deep inspiration may occur. In elderly individuals, fever may be absent, but fatigue and confusion are common. Complications can include respiratory failure, sepsis, and death if left untreated. Chronic obstructive pulmonary disease, primarily caused by smoking or long-term exposure to dust and pollutants. Symptoms manifest as chronic cough with sputum production, dyspnea on exertion, wheezing, chest tightness, and reduced exercise capacity. Complications include respiratory failure, right-sided heart failure, and recurrent lung infections. Treatment focuses on managing the disease through bronchodilators and oxygen therapy. A complete cure is not possible. Asthma, etiology involves allergies, environmental pollutants, and genetic predisposition. Symptoms are characterized by episodes of dyspnea, wheezing, persistent cough, particularly at night, chest tightness, and exercise-induced fatigue. Treatment involves bronchodilator inhalers and avoidance of triggers. Lung cancer, smoking accounts for 90% of cases. Other risk factors include environmental pollutants and genetic predisposition. Symptoms include persistent cough, hemoptysis, chest pain, unexplained weight loss, and fatigue. Late-stage diagnosis often presents significant treatment challenges. Treatment options include surgery, chemotherapy, and radiation therapy, depending on the stage of the disease. Respiratory failure, insufficient oxygen supply to the body due to lung dysfunction can result in cyanosis, heart failure, and death. B. Recurrent pulmonary infections. Elderly individuals are susceptible to recurrent pneumonia, compromising pulmonary function. Cardiovascular complications, COPD and pneumonia increase cardiac workload, predisposing to right-sided heart failure and arrhythmias. Respiratory infection prevention necessitates influenza, pneumococcal pneumonia, and COVID-19 vaccinations to mitigate infection risk. Immune system enhancement requires a balanced diet rich in vitamins C and D, zinc, and omega-3 fatty acids to bolster immunity. Adequate hydration thins mucus and prevents dry throat. Sufficient sleep and stress reduction optimize immune function. Maintaining a healthy environment involves avoiding tobacco smoke, ensuring clean and well-ventilated spaces free from dust and mold, and utilizing air purifiers in polluted areas. Respiratory and physical exercise includes deep breathing to increase lung capacity and improve respiratory function, and light exercise such as walking or yoga to improve overall health. Regular pulmonary function testing enables early disease detection. Persistent coughing or shortness of breath warrants immediate medical attention to prevent serious complications. 4. Stroke, a critical medical emergency. Stroke, or cerebrovascular accident, is a leading cause of death and significant disability among the elderly. A stroke interrupts blood flow to the brain, causing brain cell damage or death. Understanding the causes, warning signs, complications, and preventative measures is crucial for mitigating stroke risk and improving prognosis. The primary cause of stroke is the interruption of blood supply to the brain. This cerebrovascular event manifests in two principal forms: ischemic stroke and hemorrhagic stroke. Ischemic stroke, accounting for approximately 85% of all strokes, arises from a blood clot obstructing blood flow to the brain. Underlying etiologies frequently include atherosclerosis, atrial fibrillation, and hypertension. These conditions contribute to thrombus formation, leading to cerebral ischemia and subsequent neurological deficits. Conversely, hemorrhagic stroke, comprising the remaining 15%, results from the rupture of a blood vessel within the brain, causing intracranial hemorrhage. Hypertension is a significant risk factor, often acting synergistically with pre-existing conditions such as cerebral aneurysms or head trauma. The resulting bleeding exerts pressure on brain tissue, causing immediate and potentially irreversible damage. Several critical risk factors significantly elevate the probability of stroke. Advanced age, particularly exceeding 60 years, increases vulnerability due to the progressive deterioration and weakening of blood vessels. Hypertension remains the leading preventable risk factor, consistently demonstrating a strong correlation with stroke incidence. Cardiovascular diseases, including atrial fibrillation, heart failure, and myocardial infarction, substantially augment the risk of clot formation and subsequent embolic stroke. Diabetes mellitus contributes to vascular damage, fostering an environment conducive to thrombosis. Atherosclerosis, driven by elevated cholesterol levels, narrows cerebral blood vessels, further restricting blood flow. Smoking exacerbates hypertension and induces vascular damage, increasing susceptibility to stroke. Obesity and physical inactivity amplify the risk of hypertension, diabetes, and dyslipidemia, creating a cascade of risk factors. A prior history of stroke significantly increases the likelihood of recurrence, underscoring the importance of preventative measures and diligent post-stroke management. The interplay of these factors underscores the multifaceted nature of stroke etiology and the necessity of comprehensive risk assessment and management strategies. Recognizing stroke symptoms promptly is crucial for effective treatment and minimizing long-term disability. The FAST acronym highlights key indicators: facial drooping, arm weakness, speech difficulty, and time. Additional symptoms may include sudden, severe headache of unknown origin, dizziness, loss of balance, and gait instability, and temporary vision loss in one or both eyes. Stroke commonly results in partial or total body paralysis, most frequently affecting one side of the body, often accompanied by muscle spasticity and impaired motor function. Aphasia and communication disorders are prevalent, manifesting as speech loss, slurred speech, and difficulty expressing oneself. Swallowing difficulties and aspiration are also common. Cognitive impairment, including memory loss, reduced cognitive function, and confusion, is frequently observed in older adults post-stroke, significantly increasing the risk of Alzheimer's disease or vascular dementia. Post-stroke depression and emotional disturbances are expected, characterized by feelings of hopelessness, loss of motivation, mood swings, irritability, and anxiety. Importantly, stroke survivors face a substantial risk of recurrence, approximately 25% within 5 years, with each subsequent stroke exhibiting increased severity and reduced recovery potential. High blood pressure is a leading cause of stroke. Regular blood pressure monitoring and maintenance below 130/80ths of a millimeter of mercury are crucial. Cardiovascular disease and diabetes management: adhere strictly to prescribed medication for cardiovascular disease and diabetes. Limit consumption of sugary foods, refined carbohydrates, and unhealthy fats. Scientific nutrition: reduce sodium intake to mitigate high blood pressure risk. Increase consumption of leafy green vegetables, fruits, and omega-3 rich foods to protect blood vessels. Avoid alcohol, tobacco, and smoking; these increase blood pressure and the risk of blood clot formation. Weight management and regular exercise: maintain a BMI between 18.5 and 24.9. Engage in at least 30 minutes of daily exercise. Regular health checkups: monitor cholesterol, blood sugar, and blood pressure regularly. If you have atrial fibrillation or atherosclerosis, take prescribed medication as directed. Early stroke recognition: if you experience fast symptoms, seek immediate emergency medical attention. Do not self-medicate with blood pressure medication or aspirin without a doctor's prescription. 5. Cognitive decline and associated complications. Cognitive decline is a condition characterized by a gradual deterioration of intellectual functions, including memory, thinking, reasoning, and decision-making abilities. This prevalent issue among the elderly can range from mild impairment to severe dementia, such as Alzheimer's disease. Understanding the causes, symptoms, complications, and preventative measures is crucial for improving quality of life and extending the period of independent living in older adults. Cognitive decline primarily results from damage or degeneration of brain cells over time. Common causes include Alzheimer's disease, the leading cause, characterized by the accumulation of beta-amyloid plaques and tau proteins, leading to neuronal degeneration. Vascular dementia stems from brain blood vessel damage, frequently observed in individuals with a history of stroke, hypertension, or diabetes. Parkinson's disease significantly increases the risk of cognitive impairment due to central nervous system damage. Nutritional deficiencies, particularly of vitamin B12 and folate, can cause neurological damage and memory impairment. Depression and other psychological disorders elevate the risk of cognitive decline in the elderly. Traumatic brain injuries resulting from falls or severe impacts can damage the brain, impairing memory. Other contributing factors include thyroid disorders, brain infections, and prolonged alcohol or sedative abuse. Risk factors increasing the likelihood of cognitive decline include advanced age, family history of Alzheimer's disease or dementia, underlying conditions such as diabetes, hypertension, and hyperlipidemia, lack of physical and mental activity, and unhealthy lifestyle choices such as smoking and alcohol abuse. Individuals experiencing cognitive decline exhibit significant challenges in activities of daily living, including self-feeding, bathing, and dressing, necessitating complete reliance on caregivers. This population faces a heightened risk of falls and consequent injuries, such as fractures and traumatic brain injuries, due to impaired balance and coordination. Furthermore, cognitive impairment frequently precipitates depression, anxiety, and delusional thinking, with some individuals exhibiting agitation and behavioral dysregulation. Vulnerability to neglect, abuse, and financial exploitation is significantly increased due to the inability to protect oneself. Finally, there is an elevated risk of mortality stemming from complications such as pneumonia, malnutrition, pressure ulcers, and exacerbation of pre-existing conditions like cardiovascular disease and diabetes. Maintaining cognitive function, engaging in mentally stimulating activities such as reading, crossword puzzles, and learning new skills is crucial for cognitive enhancement. Regular social interaction and communication are equally vital for preserving cognitive acuity. Structured physical exercise, activities like walking, yoga, and meditation demonstrably improve cerebral blood flow. Maintaining at least 30 minutes of daily physical activity is non-negotiable. Scientific nutrition: prioritize a diet rich in omega-3 fatty acids, leafy green vegetables, and fruits. Minimize consumption of added sugars, saturated fats, and alcohol. Management of underlying medical conditions: effective management of hypertension, diabetes, and high cholesterol is paramount in reducing the risk of cerebrovascular damage. Regular health checkups are essential for early detection of neurological issues. Stress management and sufficient sleep: chronic sleep deprivation significantly increases the risk of developing Alzheimer's disease. Practices such as meditation, yoga, and walking are effective in stress reduction and sleep improvement. Prioritizing adequate sleep is a critical component of overall brain health. Emergency first aid for stroke in the elderly: do not attempt self-treatment such as cupping, acupuncture, or massage. Do not administer food or drink to an unconscious patient. Immediately call emergency services. Position the patient on their side to prevent aspiration if vomiting occurs. Loosen clothing and ensure adequate ventilation. Record the onset time of symptoms for the physician's assessment and treatment planning. We cannot turn back time, but we can absolutely control how we age. By proactively adopting the right strategies, you can enjoy a healthier, more independent, and fulfilling life in your later years. What, in your opinion, is the most crucial factor in longevity? Share your thoughts in the comments section below, and remember to like and subscribe for more valuable content. Until next time.